My name is Gabe Howard, and I am super excited to be here for another Monday edition of NAMI Tennessee at Home Facebook Live. We do these every Monday, and they are so super cool to do. And you're thinking to yourself, how would I know that you do this every Monday, Gabe? Aha! Don't worry, I have the solution. If you sign up for NAMI Tennessee's email list, you will know everything that's going on. You'll know not only everything for Mental Health Month, happy Mental Health Month, by the way, you will also know about the gala, about the NAMI walks, about NAMI weekends, about NAMI, just so much NAMI Tennessee. But you're thinking to yourself, that's a lot of emails, Gabe. Don't worry, it's one a week. It's very, very, very chill, and you'll learn a lot about NAMI Tennessee. And here's the tie-in, you'll learn a lot about how you can advocate for mental health things. And we're doing this with Alisa LaPolt. Alisa, welcome to the show.
Thanks. I'm happy to be here. You do such a great job with these, Gabe.
Oh, thank you so much. Now, we know that you work for NAMI Tennessee and you're the Director of Advocacy, but Director of Advocacy and Policy, but tell us more.
Okay. So I could tell you a little bit about my job. I am the Director of Policy and Advocacy for NAMI Tennessee, and that entails two different areas, policy and advocacy. So when we talk about policy, my job is to look at proposed laws, like bills that are being filed in the state legislature, and see if those laws and bills are advantageous for people with mental illness and their families, or if they're going to be harmful. So we actually have a lobbyist at NAMI Tennessee, and I work with him, and we go through the list of bills and track them, and then we decide which ones we're going to get involved with, and that is where the advocacy piece comes in. And my job is to rally the troops and educate them about these bills, what they do or don't do, and get them to contact legislators. And then also, as part of the advocacy piece, I teach people how to tell their stories about their journey with mental illness to the public and policymakers.
I have a few questions to start off, but let's start at the very, very beginning. You know, laws and advocacy are one of those things that's sort of a sticky wicket, right? What is beneficial to somebody may be harmful to somebody else. And obviously, NAMI Tennessee does a great job of representing everybody. What, I hate to say standard, but how do you evaluate a bill to make sure that, or policy or anything, to make sure that we're going to get the most bang for our buck and help as many people as possible, knowing, of course, that you can never make everybody truly happy?
Right. And there's a saying in politics where if you have a bill that makes everybody mad, then you probably have the right solution. So sometimes there is no 100% win on either side. So what we do at NAMI Tennessee is we evaluate which bills have the ability to even pass, because each year there's maybe 1,500, 2,000 bills that are filed, and very few of them even make the finish line. So we look at a bill and whether or not it has the power behind it and the interest to even get to a committee for a hearing and get to the floor for a vote and get to the governor's desk for his signature into law. There's no sense in burning all your energy on a bill that's not even going to pass to begin with. So that's one criteria. Another criteria is this good for the people in our community? Will it help? There might be bills that only affect a few people, but if they're like really profound bills, okay, for instance, individuals with severe mental illness make up a smaller proportion of people, but yet the legislation that could help them might be very significant. So we take that into consideration, the significance of the bill.
I know that, politics is one of those There's so many phrases. My grandmother always says that politics makes for strange bedfellows, and cool history behind that saying. But she's absolutely right. This week's ally is next week's enemy, and I know what a difficult job it is evaluating everything, knowing that you have multiple sides. And I really like your example, because you're right. If we're doing it person to person, there are more people in recovery than have severe and persistent mental illness or in crisis in any moment. But obviously, when I was in crisis, I wanted to make sure that there was a gigantic safety net. And just because I don't need it anymore doesn't mean that I want it to be ignored. And I really like what you said there about how, look, if it doesn't have any traction, we're not gonna waste our time on it. The next question that I have is on that specific point. When do you decide that a bill has traction? And I think that one of the reasons that I ask this question is because the average person doesn't understand how a bill becomes a law. We read in the paper that politicians are discussing something, but that's a far cry from coming up for a vote, etc. How do you differentiate between the scuttlebutt or something that has real potential?
Well, ideally, you want to look at the bill, talk to the sponsor, and see what he or she has in mind for this bill. And what I've done as a lobbyist is I would go around to members of leadership. Now, when I say leadership, I mean like the House Speaker, the Lieutenant Governor, committee chairs. And because those bills have to go through committees first before they go to the House and Senate floor. So you take the temperature of the people who are in charge of hearing the bills. And if they're not interested in it, then chances are the bill's not going to go anywhere. So, sometimes they just don't want to hear a bill because it's an election year and they don't want to stir up the pot too much. So you as a lobbyist, you always want to, just gauge the interest. And that's more for the professionals like me and our lobbyists as well. That's not for just the advocate out there who's just trying to work on a bill and get some conversations going.
So that makes for a great segue into what exactly what makes a good mental health advocate. On one hand, you've got, hey, I talked to the governor, and there's advocates that talk, at the federal level as well. But is that what advocacy is? That you have to be able to be a lobbyist or get a hold of a politician, or does mental health advocacy come in all shapes and sizes?
All shapes and sizes. And what I tell people is you don't have to be an expert on budgets and fiscal year appropriations and statutes. That's my job. Your job as an advocate is to be the expert in your journey. And you are the expert because you can speak to your journey from mental illness to mental wellness. And you can do that from a perspective that many other people can't. So you don't have to be a professional lobbyist. You don't have to even be a professional trained speaker. I think that anytime that you speak from the heart, that you're an advocate, and that's when your words are most effective.
Along those same lines, what specifically makes a good mental health advocate?
So I have this model that I called Pepe. You have to be Pepe. And Pepe is an acronym for passion, education, perseverance, patience, and yearning. And I'll walk through those real quick. So passion. Ideally, the best advocates are the ones that have a passion for what they're doing, for what they believe in, and they want to be able to share that passion with other people. And then the next one, education. There's a couple different things under that one. You want to educate yourself on the issue that you're advocating for. You don't have to be an expert. Again, just know, it's good to know that if you're advocating for suicide prevention, you want to educate yourselves on statistics. Like suicide is the second leading cause of death for individuals aged 10 to 34. So just, that kind of education. You also want to be able to educate the policymaker or the public or whoever your audience is. You need a willingness to do that. So the third item in my Pepe model is perseverance. I think it's important that people understand that on average, my observation is it takes 5 to 7 years for a piece of legislation to pass. I once worked on a bill in Florida that took 22 years.
Wow.
Just because of the opposition, political dynamics, and then a change in the healthcare industry. So 22 years. So perseverance is really important. Know that you're not going to change minds overnight. Now, I will say that sometimes if there is a crisis that prompts discussions on a certain policy area, like unfortunately, when I was in Florida, we had the shooting at Marjorie Stoneman Douglas High School. That did prompt some new mental health laws. But just know that's not common. Perseverance, it does take a long time to get bills passed sometimes. Patience. There's 2 levels of this. Patience with yourself. I think it's important to understand that when you're a mental health advocate, the journey from mental illness to mental wellness is not a fun one, and it's not an easy one. And there's just going to be some times where you can't get up in front of a legislative committee, or you just can't talk to a legislator or school board member just because you're just down that day. It's just, have patience with yourself and compassion, and know that it's okay just to step back and take a break. And then you want to have patience for the people that you're trying to educate, but because sometimes people don't want to talk about it. As we all know, there's still a stigma around mental illness. And hopefully you can understand that it's just going to take some time and patience for people to learn what you've been through and what people with mental illness go through. And then finally, in my Pepe model, the letter Y is yearning. And I like this because the best advocates are the ones that yearn for a better world, a better healthcare system. They don't want to see other people go through what they've been through, a yearning to make a difference.
I love the Pepe model for 2 reasons. One, my dog is named Pepe, so obviously I've got that connection. But 2, because it makes a lot of sense. And patience, perseverance, and I love that you broke patience out into 2 separate categories, because I am an impatient person, and it was very difficult for me to learn that the world does not pivot as quickly as I think that it should, or that I want it to. But in the beginning, I thought that was my fault. That the reason that people weren't listening is because and I was very impatient with myself. Well, Gabe, if you would have explained it better, if you would have done better, if you would have given a better speech, had a better website, told a better personal story. We tend to think of advocacy like the movies, right? Where there's this, this impassioned speech, and suddenly all the votes change. And that's very unusual. I'm never going to say that it never happens that way, but I don't think it actually does. When it comes to being a mental health advocate, is there any specialized training that is needed, or can anybody do it, or is it sort of a combo deal? It sort of depends on what advocacy you're leaning toward.
Yes, it is a combination. Ideally, you would want a mentor or somebody to help guide you through what a conversation would look like. If you're wanting to speak with legislators in a meeting, or like at a committee meeting, you definitely want to do your research and maybe talk to a lobbyist. So at NAMI, we have this fabulous training program called NAMI Smarts. And I recently got certified as a teacher here in the state of Tennessee. So through NAMI Smarts, you can learn how to tell your story in an efficient, effective way. We have an elevator speech. And for those of you who don't know what an elevator speech is, imagine you've got 90 seconds. You get on the elevator with a legislator at the Capitol, and you, like, the one legislator, say the chairman of a committee, you got 90 seconds to tell your story. What are you going to tell? Are you going to go through your list of medications that didn't work for you until you found the right one? No, you just say, Senator, Representative, I would love for you to consider medication alternatives because you just have that 90-second story that you tell. And so the NAMI Smarts also teaches people how to combine facts and figures and with the story, the personal story. So if anybody out there in NAMI land wants a NAMI Smarts training this summer or fall, let me know. My email address is advocacy@namitn.org.
You can also hit up info@namitn.org just because that's the one that I can pop on the screen, and I promise it'll make its way over. And of course, you'll know when they're all coming. Everybody knows what I'm going to say. If you sign up for the email list. The email list is really, really cool. We highly recommend it. That way you miss nothing. While we're on the subject of announcements real quick, and something else that you would know if you sign up for the NAMI email list, the NAMI Walks is May 22nd. Just head over to namiwalks.org/Tennessee. It's virtual again this year because we still live in the COVID environment. We want everybody to be safe. So it's really NAMI Walks your way. It's super, super cool. And look, even I had fun participating in it, and I am so tired of the quarantine. I'm just at my wit's end. So it's really a lot of fun, and Anna does an incredible job. Keeping along the specialized training question, let's say that you have no training, you're sitting in a restaurant, and somebody says something that's incorrect. They say that they're talking about the news, and they say, well, what do you expect? Everybody with mental illness does that. Are you allowed to advocate? Is it a good idea to advocate? What advice do you have for advocacy? And I suppose, is that advocacy in the scenario that I just described?
So typically when we talk about advocacy, we're talking about taking actions that sway or influence an outcome. So talking to a legislator, a school board member, a metro council member on like a bill, a proposition, and so forth, with an outcome of passage or defeat. But there is advocacy just in terms of general education. And Lord knows we need a lot of education around mental illness and the stigma. So to your point, if you do overhear somebody having that conversation, yes, I think there is an opportunity to educate, but my advice would be to make sure that you yourself are in a good place to have that conversation. If you're fresh in recovery and easily triggered, that might not be the best time to step in and have a conversation like that. Make sure that you, and we talk about this in NAMI Smarts, make sure that you are emotionally ready to tell your story. And then the second thing I would advise is try not to be judgmental because, we are in such a polarized environment politically. And with everything from masks, no masks, Republican, Democrat. So try not to impose your view and your will so strongly, and understand that people's knowledge level on mental illness isn't going to be like yours. So compassion is super important.
One of the things that I try to remember as an advocate is when we hear things that we don't like or that are offensive or that bother us, we immediately think that the person is being malicious. It's our knee-jerk reaction. They are being mean to us. And if you've been around NAMI or advocacy or anything for a while, we're like, aha, that's stigma, right? And we're ready to go fight stigma. And on one hand, that has served us well to keep us motivated, but I think it's not exactly what's happening. I don't think that it's entirely malice. In fact, more often than not, I don't think it's malice. I think it's misunderstanding. I think it's ignorance. And I think that if we took a hard look inside ourselves when we were first diagnosed, or when a loved one was first diagnosed, or when we first started this journey, we kind of said a lot of stupid things too, because we're learning and because we don't understand. And if people came at us and just started yelling, we dig in our heels to defend ourselves because We don't think we're bad people. So I really think it goes a long way to think to yourselves, okay, they're missing some context or they're missing some information, and I want to politely and respectfully fill those pieces in. And then whatever they do with that information, that's out of our control. And we have to be good with that. Our job is to deliver the information and hope that it works out. And I have to say, doing this for a long time, it almost never works out in the moment. But people come back to me days, weeks, month later, and they're like, I was thinking about that, Gabe. That's a good point. And I'll remember the discussion. I'm like, for 20 minutes, you told me that I was wrong. But because I was respectful, it seeped in. You talk about your training or the SMART training at NAMI. Does it discuss all of this? Does it go over this? Because again, I do think that it's a missed skill set when we're learning to tell our stories or to educate people. This idea that they're not being mean.
Right. And so you bring up a good point. Certainly, there is an opportunity to explain things in a respectful way. One area that I have some difficulty with that I have run into is the notion that suicide is a sin. And in some religious practices, that is the case. And it is the one that I have a lot of difficulty with. My own nephew died by suicide. And so it hurts my stomach when I hear somebody say that, because I know what my nephew went through. And there's an opportunity where I can respectfully say, no, actually, it's it stems from mental illness, and mental illness is an illness, just like diabetes, cancer. And you wouldn't call a cancer victim a sinner. So it's real important for me and for anybody advocating just to try to keep the emotion out of it and look at it as an education. And there's some people that you're just not going to convince. And that's okay. That's their journey. That's, their life, how they want to live it. But, I have had those difficult conversations. And when I tell them about my nephew, their eyes get big and like, wow, that could happen to her. It could, wow, so there is that opportunity there.
One of the beautiful things about storytelling is it lends context to the abstract. We're often talking about mental illness, mental health issues, and legislation, etc., as if it doesn't impact us because we don't have like a personal stake in the game yet. And it's very easy to just say, well, that happens to other families or other people, and there's no face. Is telling your personal stories, is that the goal, to put a face and to give a human connection to what would otherwise be just a random story that somebody read in the paper?
Oh, definitely. One reason is because mental illness is so much more prevalent than people realize. And when we talk about mental illness, we're talking the gamut from anxiety, depression to, schizophrenia and bipolar disorder. And I think it's important that policymakers understand that, because certainly everybody can identify now, 14 months into a pandemic, with anxiety and depression. And when they start thinking of that as, oh, this is a mental health challenge, then it hits home with them. So anytime that we can tell our stories about how a mental health challenge or mental illness has affected us, it's a bonding opportunity. And I can tell you, I can think of at least 5 times where I've walked into a legislator's office and sat down, started talking about a bill, and they've stopped me and said, I know my grandmother was institutionalized, or I know my spouse has depression. Now, they won't say that publicly, but they'll say it to me. And one of the most rewarding experiences that I had as a mental health lobbyist was in Florida. I'm looking forward to more rewarding opportunities here in Tennessee. But it was when we had a bill on first episode psychosis, and the bill in Florida would have created a system of care and protocols when an individual has their first psychotic break, which usually occurs for many people in their 20s. And the importance with a psychotic break is to get treatment quick because it stops the deterioration of the brain, get the medications, get the wraparound services. And so this bill would have created this system of care. And the sponsor of the bill stood up in front of the committee and, as she was telling the story, broke down and started crying. Now, I knew the story behind it. She didn't say it publicly, but she had a family member growing up with bipolar. And what started happening was, in the legislative committee, legislators grabbed the microphone and said, I wish my family would have known this because I could have gotten help for my sister. And like 2 or 3 other legislators started talking about their family's experience with this. And it was stunning. And then when the bill got to the House floor, the same thing. On the House floor, legislators were openly talking about this particular piece of legislation. And it was great. Unfortunately, it did not pass that year. But the point is, it made it real, because so many times, bills and legislation can be boring. But when you see the effects and hear about the potential effects, that makes it worthwhile to legislators too, not only the advocates. It's great for the stakeholders, policymakers, and it makes it that much more rewarding.
Now, I know that you have said, and you sort of gave an example of where personalized stories made a difference. Do you have any specific examples of when personal stories have made a difference in public policy?
I do. And there's one that took place here in Tennessee, and I'm very proud of our efforts with all of our NAMI Tennessee advocates. There was a bill that was filed. It's called the Teacher Discipline Act, and it would have given teachers very broad leeway in yanking a kid out of the class and dismissing the kid from class, taking the student to the principal's office, and having that student like permanently removed from the classroom. And we were pretty appalled because the bill had no safeguards to bring parents into the process, or even consider that the child might be in a mental health crisis. And as we know, children a lot of times are from traumatic. They have traumatic incidences that happen. A lot of kids are, many of them live in abused homes where there's abuse. So the adverse childhood experiences, called ACEs, are very high in some cases. So you don't know if that child is just misbehaving or if they are having a crisis. So we actually sent out an email, I think, to our list of 5,000 advocates on our NAMI Tennessee list. And I asked them, will you please write these legislators on this committee, this bill is being heard, and explain to them why we oppose the bill. 1, because parents aren't involved. 2, because there's no consideration for mental health services. And 3, it's just unfair. And when we got to the committee, one of the legislators said, I have literally had hundreds of emails on this bill. And what ended up happening was, by the time it passed, it got amended to include language where teachers and school board policy needed to reflect evidence-based practices, and that it needed to be consistent with like federal laws. So what all that means in plain language is there needs to be protocols for how this is done. And we got that. I'm wanting NAMI Tennessee and our advocates to take credit for that, help take credit. It was other organizations too. And that's a situation where we worked with the Disabilities Coalition to get that passed. So advocacy can involve coalitions with other people. We routinely work with others. So that was a really big win for us.
That is incredible. Now, one of the things that I'm thinking about is you talked about positivity, and even in that story, lots of context, lots of great outcomes, lots of wins. But I think a reasonable question is, what if the story doesn't end positively? What if it doesn't have that good ending? What should you do then?
Yes, and you heard me say earlier that the journey from mental illness to mental wellness is sometimes not fun or easy. And when it comes to advocacy, there's a couple different ways to tell a story. So one is to tell the story around what can happen if a policy is passed. So, for example, mental health walk-in centers. We've got a handful of walk-in centers here in the state of Tennessee where you can walk in if you're in a mental health crisis, get immediate services and so forth. Well, a good policy would be for Tennessee to fund more of these walk-in centers. So the story behind that might be, here's what happened to me when I went to a walk-in center. I got referred to a therapist. I got a diagnosis. I got medication. I am now working a full-time job, and I am living an optimal life, a productive life, and happy. Okay, that's a story with a happy ending. There are stories that don't end so well. So the story might be that a person had to drive 3 hours to the nearest walk-in center and didn't want to do it, and then decided to overdose on drugs. So in that case, a family member would be able to tell the story, this is what happens when this policy is not happened. And having that balance is important, because it's important to see, to show a policymaker the effects of passing or not passing a policy.
I completely agree. I think that sometimes in our trauma and in our grief and in our desire to move things forward in a positive way, we realize, or we don't realize, that by burying the worst case scenarios, we're giving this false idea to policymakers that the worst case scenario never happens. Because after all, they're not hearing about it. And as sad as those things are, and believe me, I know I'm sort of speaking to the choir here, but as traumatic as they are, it's that trauma that does make people realize that, okay, change is needed. And as unfortunate as it is to be in that situation, some good can come from it. And in that way, the story will eventually potentially have a better ending, because it might drive change. I think about that a lot with folks that I work with. Let's make something positive out of this, and that helps. When we have a question, it's a little bit older. It's from Bob Creighton. How many modules are there for NAMI Smarts?
Oh, let's see. I believe there are 5 or 6, and each one is about an hour and a half to 2 hours long. So what we do with the NAMI Smarts training is do 1 or 2 modules at a time. It might be an afternoon training. If you want to do all 6, you're looking at a weekend training. And right now we're still in a pandemic, and things are starting to open up, but we can definitely arrange to have a webinar, like a Zoom training, over a few weeks. So if that's something that you're interested in, please contact us at info@namitn.org.
And is the training right now one-on-one? Is it group training? What's it look like? Do a bunch of people get together, and then once they're trained, how do they get assignments? And is assignments the correct way to put it? What happens after you're trained?
So the training, ideally in a non-COVID world, is in a group. So maybe about 20 people, because you want to educate people, give them the checklist on what to say, how to say it, and then you want to give them the opportunity to practice on each other. And the really great thing about NAMI Smarts is there is a worksheet that guides you through telling your story, and it builds your story. Like, here's my experience. Here's how it made a difference in my life, and here is my ask. It's always important to walk in when you're advocating, to walk into a meeting or situation where you have an ask, like more funding for walk-in centers, more insurance coverage for Medicaid for low-income people. So, like I said, you have that checklist of things to do. So once you have the training, then you get on my mailing list, and we'll send out advocacy alerts. Like I said earlier, I sent an alert out to 5,000 people asking them to email legislators about this bill. So that's when you spring into action. And so you'll be able to use those skills from the NAMI Smarts training and put them into action by reaching out to legislators. We also have a day on the Hill, which is typically each year during a legislative session. And I do like an overview of the NAMI Smarts training, and then give people policy papers, and I give them the policy background ahead of time, and they pick which bills they want to advocate for, and then go meet with legislators. Now, this past year, back in February, we actually had days on the Hill, and I spread it out over like 4 weeks. We did different trainings and different advocacy conversations around the importance of advocating as a person of color, because so often people in the African American community don't seek mental health treatment. There's a stigma, and there might be some hesitation, and they might not have access to those services. Also, I taught them how, like, individuals in the LGBTQ community, why it's so important to be a mental health advocate, because in that community, mental health challenges are so much higher than, like, the rate is so much higher because of the challenges they face. So yes, so I was teaching them how to tell their story, and also use facts and figures to bolster their story.
Do you feel that a good 1-2 punch is that personal story for context, and then you said use the facts and figures? So this is how it impacts Gabe personally, and these are the facts and figures of why it impacts Gabe personally. Is it, if I understand you correctly, that's the key, right? It's the double whammy, for lack of a better word.
Oh, yes. I mean, I could sit and talk to somebody about my depression after my father died, or my anxiety and depression after I got divorced. And I also, he was my business partner. So lots of financial anxiety there. So, to the person who's hearing that story, they might shrug their shoulders and say, oh, that's sad. But when I then tell them that 1 in 5 people have a mental health challenge in a given year, all of a sudden that story changes. That's 20% of the population. And then when I tell them that now, because of the pandemic, it's looking more like 1 in 2 people are facing a mental health challenge now. Suddenly, it's not just about Alisa, it's about the community, it's about the state, it's about the country, it's about so many more people. But I'm able to tell the story about how therapy has helped me immensely kind of sort through, everything from childhood to grief and depression. And in some cases, I've been on antidepressants, and I'm able to tell that story. And but then when I say, but I'm just 1 in 5 people, imagine me, I represent the one. If there's 5 people in the room, 20% of the population has this. It's not just me.
I could not agree with you more. I live with bipolar disorder, and I want to show politicians, policymakers, people who are making decisions, that recovery is possible. That's like super important, right? But I also don't want to leave them with the impression that it's easy. I don't want them to think, oh, well, bipolar disorder. We met this one guy and he's fine, so clearly it's no problem. I want them to know exactly how many people aren't doing as well as me because of their not being able to get access to care. So, I always explain that it took me 4 years. Like, that's a big data point, right? And it took 4 years, even though I had health insurance. I lived in a big city, so access to care was easy. I could see a psychiatrist every 6 weeks. These are starting to fill in the puzzle a little more. And then when I let them know that, depending on what the averages are at the time, that there's 2% of the population that are not doing as well as Gabe, but they could be, and 2% equals 100,000 people. You've got 100,000 people that aren't doing as well because they can't get access to the same thing that I did. That's really powerful, because I would like to believe that people want everybody living with bipolar disorder to reach recovery like I was able to do. But it's important that they understand that I was able to do it not because I'm special or because I worked harder, but because I had access to medical care. That's like a really, really big deal. Alisa, I know we're sort of rounding the bend into the last third of the show, and I want to take some time to talk about what exactly Tennessee is advocating for. What are some of the things that NAMI Tennessee is advocating for, like right now?
Yeah, so we have 3 areas that we've identified, just like from our board of directors, where everything we do, we would like them to be in these 3 silos. And one is getting help early. The second one is making sure that people will get the best possible treatment and recovery care. And then the third is diversion from criminal justice. So I'll kind of break those down. Getting help early could mean a few different things. One is getting help early for youth and young adults. We start to see symptoms of mental illness as young as 13. And you mentioned getting help in 4 years. The average is 11 years. So we want to get that help early. It also could mean getting it early in their mental illness journey. Like I said earlier, when there's a psychotic break, it's critical to get help early to slow that brain deterioration down. Then the second thing is people getting the best possible treatment and recovery care. That means access to care, making sure that we've got, like you said, access to psychiatrists. There are some counties in Tennessee, and well, this is national, that simply don't have psychiatrists, psychologists to treat people. There are waiting lists. And then finally, diversion from criminal justice. That means getting people help, not handcuffs. There's this great program called CIT, Crisis Intervention Team, and NAMI Tennessee not only has a grant, but we have state funding to help teach law enforcement officers how to respond to a person in a mental health crisis. And through this program, we also bring together communities, stakeholders, mental health professionals, law enforcement, and create a collaboration on how to get help. Where are the resources in the community? How can law enforcement get someone to the nearest walk-in center or treatment center? So those are the 3 areas, like the silos, so to speak, where we have our priorities.
This is, you may not know the answer to this question. I'm just curious about it. How close is NAMI Tennessee from meeting any of these goals? Is any day now the tide going to change? Has the pandemic made things even longer? Is there, and I know it's just an opinion, you can't control what the government does, but are we close to a big victory?
We actually did have a big victory this year at the legislative session. And this is a bill that we had been working on for several years. It's called insurance parity. And what that means is that health plans are required by federal law to provide mental health and substance use treatment and recovery services just as they would for physical health. In other words, you can't have a different standard. You can't put limitations on the amount of treatment and the scope of treatment and how long the treatment is. You can't put those limitations on mental health and substance use disorder, but yet, let physical therapy, like unlimited physical therapy for your knees, or you see what I'm saying? It's called Parity. So here in Tennessee, we wanted to see whether health plans were following that law. And we'd been working on a bill that would require the Department of Commerce and Insurance to do a review of that. So the law that just passed, and like I said, we're thrilled about this, would require the Department of Commerce Insurance to pull down those reports from the federal government. So in December, there was a bill that passed on the federal level that required the health plans to report to the federal level how they're complying with that law. So now in Tennessee, they get to, our State Department will take that information and report it to the legislature every year. So we can finally see if and how health plans in Tennessee are complying with the law. Are they making it more difficult for people to get services? Are there enough psychiatrists in the network? Are there higher copays? And if so, we can do something about it. There's a way to complain. There's a complaint form on the Department of Commerce and Insurance website. And we have been working with the department. They've been really good to work with on making that complaint form available. But that was a big win for us, that now the legislature will know every year how health plans are doing.
That is, I have always thought that it's just incredible to me. It's like, well, I have bipolar disorder. All right, you get 6 visits. Well, but what if that's not enough? You get 6. Okay, but what if that's not enough? You get 6. I don't know where I'm losing you. If you can get it done in 6, that's fantastic. But they decide the number. They don't know how you're doing when they decide that number. It's determined before you were ever diagnosed, before you ever get sick. They've just determined that that's the average. Well, the average has a built-in problem. Some people will be lower than that number and they're okay, but in order to get that average, some people have to be above it. And those people, if they can't afford to pay out of pocket or find sliding scale or find care, often don't get the care that they need. And then once again, that's an excellent stat to bring up to politicians.
Right.
What does the future hold? I know that's just a really open-ended question, but if you were in charge of everything, what would NAMI Tennessee like to see policymakers and the governor of Tennessee pick up and finally do something about? What are some more, you've got your everyday goals. What are some stretch goals that NAMI Tennessee would like to see?
So we have really committed to a couple of different areas. One is youth and young adult. The number of suicides and suicide attempts is just staggering now. And people are finally starting to pay attention. So we just learned that the governor in the legislature here in Tennessee passed in the budget $250 million for a trust fund that would ideally be matched by private corporations and then state funding. The money would go to K through 12 education. We're not sure of all the details yet, but ideally mental health awareness and access to counselors and so forth. There was a bill that did not get passed this year, it was purely because of the price tag on it. It would have put more counselors into schools. So, if it were me, I would love to see that bill passed, a system where the schools can divert kids either to care in the communities or there on site, mental health, like some type of crisis, a triage type of a team approach, or protocols for getting them care. So that's one area. Another area that we at NAMI Tennessee and NAMI nationally have really started focusing on is racial disparities in healthcare, and particularly mental health care. One of our national priorities is supporting community inclusion and non-discrimination. And so what that means is that we fight for policies that end discrimination and help people engage in communities and focus on healthcare. That includes promoting access to education, employment, income supports, and housing. Housing is a big issue for individuals with mental illness, and you should not you should be able to get housing whether you're white or black. That shouldn't be an issue. So we support any policies that make access to those services equal.
That is great, and I could not agree more. One of the most difficult stats that I ever read was your race determines the stats were different for different races based on the access to care that you got, or if you got a diversion program versus not a diversion program. Also, along those same lines, your zip code, exact same symptoms, diagnosis, issue, but certain zip codes just had much better outcomes for people in a mental illness crisis than other zip codes. And the only difference was the zip code. And then when you broke it down, differences started to become race, gender, socioeconomic status. And it's like, wow, just it's just so unfair. It's devastatingly unfair. So I'm really glad to see that.
I agree. And that's one of those issues that we talk about the Pepe model that I had, a passion. My passion has been access to healthcare. I mean, I've been a professional lobbyist now for almost 2 decades. And to me, it is a fundamental right that people have access to healthcare. And what we have is, here in Tennessee is one of 12 states that has not made Medicaid, here we call it TennCare here, but we've not made Medicaid available to more low-income people. And this is one of the things we're going to be working on over the summer, is building a coalition of storytellers, of advocates who can help us tell the story about why healthcare coverage is so important for mental health treatment. We know when people get access to treatment, they can live optimal lives, productive lives, happy lives. So why wouldn't you want to invest money on the healthcare side of things and save money in hospitalizations, in inpatient programs, medication, get them the help on the front end with the insurance coverage, and then you save money. So
I have a saying. I always say, you're going to pay. Mental illness is one of these societal issues that you're either going to pay now or you're going to pay later. And as we have learned from credit cards, it is never ever cheaper to pay later. And I think that it's really powerful advice, because the money is being spent. Whether it's in law enforcement time, whether it's, unfortunately, prisons and jails have become de facto mental hospitals, which is not providing good quality of life or care. But more importantly than that, to policymakers, it's extraordinarily expensive. Jail and prison is more expensive than health insurance and community supports. And yet many people end up there. So from a warm and fuzzy, what would make Gabe happier? I'd love to see people get the help that they need, just because, like, that speaks to me. But I guess we're throwing that out the window, and let's just do it because it's cheaper. And right now I seem to be losing both battles. That's why I'm so happy that you're around, Alisa, because you've just done incredible work. I know that NAMI Tennessee loves you very much, so thank you. I want to give you the almost last words. Don't worry, I'll be back to tell everybody to sign up for the email list and tell you all about the NAMI walks on May 22nd. It's on the screen right now. Look at it over there. But do you have any final words, Alisa?
Yes, we're always looking for storytellers. If you have had a mental illness, if you have a loved one with a mental illness, I would love to talk with you. Some of the issues we're going to be working on, as I mentioned, are Medicaid coverage for low-income people. We want to hear if you've had an experience with law enforcement, good or bad, because there's opportunity for change there. And if you're a young adult or a person of color, we want to try to get those conversations going around mental health for individuals who, Black, Hispanic, LGBTQ. we want to start sharing those stories. So please contact us. Love to put you on my storyteller list and train you and teach you how to be a great advocate.
Alisa, thank you so much. All right. So as promised, I'm going to tell everybody to sign up for the NAMI Tennessee email list. Just go to, oh, I put the wrong one on the screen. Look at this. All right, here we go. Join NAMI Tennessee's email list just by going over to namitn.org. I promise you'll get everything that you need, including updates from Alisa about advocacy, and of course, be informed of events like this. Additionally, we want to formally invite everybody to NAMI Walks Tennessee. It's on May 22nd. It's virtual. It's a lot of fun. Anna just does an incredible job. She's our walk manager, and she is super cool. And she works with Alisa. So, I mean, just the coolest people work at NAMI Tennessee. You can learn more just by going to namiwalks.org/Tennessee. And of course, we can always utilize your donations. It very, very much helps. But we'd really, really like you to participate as well. Participation, please correct me if I'm wrong, Alisa, participation is a form of advocacy. Stand up and be counted. Show people that you can live well in spite of mental illness, right?
That's perfect. Well said.
Thank you so much. All right, everybody. We will see you next week here on NAMI Tennessee's Facebook.